Good afternoon, everyone. Bonjour tout le monde. My name is Yasir Naqvi. I'm the Member of Parliament for Ottawa Centre. I'm pleased to be joined by my colleagues, the Honourable Jean-Yves Duclos, Minister of Health, Honourable Marci Ien, Minister of Women and Gender Equality and Youth, Jill Doctoroff, Executive Director of National Abortion Federation, and Frederique Chabot, Director of Health Promotion at Action Canada. I would like to acknowledge that we are gathered on the unceded and unsurrendered territory of the Algonquin Anishinaabe peoples. I'm pleased to be here today to talk to you about the very important issue of strengthening access to abortion and reproductive health services. As we witness the situation and debate unfold in the United States, our laws in Canada are clear. Women have the right to safe and consistent access to reproductive health care. We will always stand with women and promote, protect, and support their right to choose. Chaque femme au Canada a droit à un avortement sûr et légal. We will never back down from supporting women's rights here in Canada and around the world. I am reminded of a few years ago when, as Ontario's Attorney General, we worked with activists and women's rights groups and helped pass legislation that created safe access zones around abortion clinics, such as one down the street right here on Bank Street in my riding, so that no woman has to face interference, intimidation, or harassment when accessing abortion and reproductive health services. This law remains in place today to further protect women and their rights. Today, we are joined by two incredible organizations: Action Canada for Sexual Health and Rights, whose mission is to uphold reproductive and sexual rights and health in Canada and globally. We also welcome the National Abortion Federation Canada that promotes and enhances and ensures access to quality abortion care. Nous avons la chance de voir ces incroyables organisations qui travaillent chaque jour pour défendre et promouvoir les droits des femmes et garantir le droit d'accéder à des services d'avortement vitaux. J'ai maintenant le plaisir de vous présenter l'honorable Jean-Yves Duclos, Ministre de la Santé. It is my pleasure to introduce Minister of Health, Duclos.
Bonjour à toutes et à tous. Good afternoon, everyone, and thanks for joining us. Today, I'm joined by my colleague, the Honourable Marci Ien, Minister for Women and Gender Equality and Youth, our colleague, Yasir Naqvi, who is MP for Ottawa Centre in this particular riding, Frederique Chabot from Action Canada for Sexual Health and Rights, and Jill Doctoroff from the National Abortion Federation Canada for an important announcement. In Canada, everyone has the right to safe and consistent access to reproductive health care, including abortion services. In other words, in 2022, in this country, sexual and reproductive rights are human rights, plain and simple. Pour de bonnes raisons, en ce qui concerne les droits des femmes et les libertés individuelles, nous sommes fiers des progrès que nous avons réalisés au cours de notre histoire, mais nous savons également que nous ne pouvons pas nous permettre de tenir ces droits et libertés pour acquis. Comme vous le savez, au Canada, le droit à l'avortement a été gagné de haute lutte après des décennies de combats menés par les mouvements féministes et ses alliés. En 1988, la Cour suprême a clairement établi que les dispositions du Code criminel canadien qui interdisaient alors l'avortement étaient anticonstitutionnelles. L'année suivante, dans l'arrêt d'Aigle contre Tremblay, la Cour a également reconnu qu'il appartenait aux femmes, et aux femmes seulement, de décider ce qu'elles souhaitaient ou non faire de leur corps. Ces victoires juridiques étaient à la fois fondamentales et révolutionnaires. Et bien que ces victoires soient gravées à la fois dans notre mémoire nationale et juridique, l'évolution de la situation aux États-Unis nous rappelle à toutes et à tous que nous ne pouvons pas tenir ces droits et libertés pour acquis. The legal debate over the right to abortion is closed in this country, but that doesn't mean that the fight is over. The legal battle has been won, our regulatory framework is strong, and yet, for too many Canadians, access to abortion remains a significant challenge. Access, that is where our efforts should be focused, and that is why we are here today. Même si certains souhaiteraient nous ramener en arrière, la réalité, c'est que le débat juridique est clos et que la liberté et le libre choix des femmes l'ont emporté. Pour autant, cela ne veut pas dire que la bataille est terminée. Le cadre juridique et réglementaire entourant l'avortement est solide, mais partout à travers le pays, l'accès à ce service médical demeure inégal. L'accessibilité, voilà ce sur quoi nous devons concentrer nos efforts. Et c'est d'ailleurs précisément pour cela que nous sommes ici aujourd'hui. Nous savons qu'encore aujourd'hui, de trop nombreux obstacles demeurent, notamment en matière d'inaccessibilité, de manque d'argent pour le transport, de manque d'informations et de ressources d'accompagnement, pour n'en nommer que quelques-uns. In fact, the COVID-19 pandemic has worsened these barriers by making the already limited healthcare resources even more stretched. This continues to affect sexual and reproductive health services across our country. Today, we are here to reiterate our commitment to protect, promote, and improve access to reproductive health services across the country. Aujourd'hui, nous sommes ici pour réitérer notre engagement à protéger, promouvoir et améliorer l'accès aux services de santé reproductifs partout au pays. Everyone in Canada, no matter their circumstances, should have access to comprehensive sexual and reproductive health care, and that includes access to safe, accessible, and stigma-free abortion services. J'ai donc le plaisir d'annoncer aujourd'hui du financement pour 2 projets importants dirigés par Action Canada pour la santé et les droits sexuels, ainsi que par la Fédération nationale de l'avortement du Canada. These projects, which are supported through Health Canada's Sexual and Reproductive Health Fund, will improve access to important reproductive health care services, including abortion services. Action Canada recevra un financement de plus de 2 millions de dollars pour accroître l'accès à des renseignements fiables et valorisants sur la santé sexuelle, y compris des références vers des professionnels compétents, et fournira aussi un soutien financier et logistique pour les déplacements. The National Abortion Federation of Canada will receive more than $1.4 million in funding to provide financial and logistical support to those seeking abortion services. It will also train healthcare providers in abortion provision and support facilities to maintain the capacity to provide related services and care. These investments reflect our belief that women and women alone have the right to make decisions about their bodies, as well as our unequivocal commitment to ensure comprehensiveness and accessible reproductive health care for all in Canada. Avec le financement annoncé aujourd'hui, nous continuons et continuerons de lutter contre les obstacles qui empêchent l'accès à un avortement sûr et sécuritaire. As you know, these are just some of the projects that the $45 million fund committed and announced in Budget 2021 will allow us to support. My colleague, Minister Ien, and I will soon have the pleasure of confirming additional investments in similar projects across the country. Merci, Ministre Ien.
Merci, Minister Duclos. It's my pleasure to be with you today, and MP Naqvi. So good to be with you today. I want to begin my remarks with acknowledging that we are gathered on the traditional territory of the Algonquin and Anishinaabe people. Hello, everyone. Bonjour. Jill Doctoroff from NAF, Frederique Chabot from Action Canada. Delighted to be with you here as well for this important announcement. Et merci à tous pour votre travail important et votre appui. As the Minister for Women and Gender Equality and Youth, I want to be crystal clear. I'm committed to protecting the right of people in Canada to access safe and legal abortion services. Crystal clear. Generations of women have fought for far too long, fought far too hard to have these rights slip away at the hands of a minority who mistakenly believe that women should not have agency over their own bodies. Our position is appropriately summarized by what the Prime Minister said earlier this week. The freedom of a woman to choose belongs to her and her alone. But that choice is more than just ensuring the abortion is legal. The freedom to choose also means having access to these services, no matter who you are or where you live in Canada. Mais c'est là que nous avons du travail à faire. The advocates that are here today, Jill, Frederique, and their organizations, they know that far too often, LGBTQ2 people, Indigenous, racialized people, women and youth face barrier after barrier after barrier when trying to access sexual and reproductive health care services. And despite abortion being decriminalized more than 30 years ago, those who live in remote areas accessing these services is even harder. These barriers often come down to logistics. They come down to finances for these underserved communities. Not everybody has money to travel for these services. Not everyone has a car. Not everyone can take time off work. But let's be clear. No one should be denied an abortion because it is too far to travel or too difficult to coordinate an appointment. We know that we have to do better. And that's exactly why we're here today to announce these projects that will address these real-life barriers faced by intersectional communities by assisting with travel and accommodation costs and connecting people with the resources that they desperately need. For generations, the women's movement and organizations from coast to coast to coast have worked to improve and protect access to sexual and reproductive health services. And we are here today to send the clear signal that this progress will not be reversed. Not now, not ever. Our government will continue to work alongside organizations that support a woman's right to choose and organizations that believe everyone should have a chance to fully participate in Canada's social, economic, and democratic life, regardless of their gender, gender identity, gender expression, or sexual orientation. Nous croyons que chaque personne devrait avoir accès aux services de soins de santé dont elle a besoin indépendamment de sa situation ou de sa capacité de payer, et l'avortement est l'un de ces services. While today's announcement is a step in the right direction, and it most certainly is, we must never, ever let our guard down. We must never allow anyone to turn back our progress. And we will continue doing everything in our power to make sure that we keep moving forward. Thank you. Merci beaucoup. Jill, it's over to you.
Thank you very much, Minister Ien. As I said, my name is Jill Doctoroff. I use she and her for my pronouns, and I'm the Executive Director of the National Abortion Federation Canada. NAF Canada promotes, enhances, and ensures access to quality abortion care. And some of the ways that we do that are through training and education for healthcare professionals and helping people who have access barriers to the abortion care that they need. And so we're really grateful for the funding that we'll be receiving from the federal government through Health Canada to support those programs. So currently in medical schools, in nurse practitioner programs, and in midwifery programs, there's very little or no training around abortion care. So healthcare professionals who are going to be providing the healthcare that people need don't have the information. So we provide ongoing training for folks who are involved in providing abortion care, and a few years ago identified the gap in this training for people who might be interested and have developed some training programs and will continue to develop training programs. We'll also be working with medical schools, nurse practitioner schools, and midwifery programs to help them incorporate abortion care into their training. And currently, if somebody wants to learn how to do procedural abortion, they rely on connections, if they have any, the generosity of people who are currently providing abortion care. There is no hands-on training program for family care physicians, and very little for obstetricians and gynecologists. So we'll be creating a hands-on aspiration abortion training program. And this is really important because to ensure access, we need to have the healthcare professionals who support and who are trained to be able to do the procedures. Another thing that we'll be working on and continuing to work on, up until now we've relied on the generous donations of Canadians, and now we'll be receiving some funding to actually help people travel. So there's lots of parts of the country where we have limited access to abortion care. If you live in the Maritimes, you can't access abortion care past 16 weeks. Where you live in the country shouldn't be something that determines how much health care or what kind of health care you get. So we get calls on a regular basis. We had over 150 people reach out to us last year alone, looking for support of where they could get abortion care and also help to get them there. We also help Canadians leave the country to access abortion care in the United States past 24 weeks because it's very difficult to access abortion care in the country at that stage. And those costs can be prohibitive for people who are regular Canadians living their lives and don't have a lot of finances. So those are some of the things that we're going to be doing and continuing to doing to make sure that access isn't an issue for people who need abortion care. And I think I'll pass it over to you now, Fred.
Thank you. It's a real pleasure to be here with all of you for this historic announcement. My name is Frederique. I use she, her pronouns. I'm the Director of Health Promotion for Action Canada for Sexual Health and Rights. We were formerly known as the Planned Parenthood Federation of Canada and also as CORAL, the organization that fought alongside Dr. Henry Morgentaler for the decriminalization of abortion in Canada. We are a charitable, progressive organization committed to advancing sexual and reproductive health and rights in Canada and globally. We are active at the Human Rights Council since 2012. Building on the 50-year legacy of the organizations that formed Action Canada, we work to promote health, equity, well-being, and human rights related to sexuality and reproductive care. Anchored by our frontline services, Action Canada advances rights-based policies to improve access to abortion, stigma-free healthcare, gender equality, LGBTQ+ rights, inclusive sex ed, among many other issues that intersect with bodily autonomy, gender, sexuality, and reproduction. Our frontline services include a toll-free pregnancy information and referral service paired with a national abortion access financial aid program called the Norma Scarborough Emergency Fund. We speak to thousands of Canadians every year, and since January alone, we have supported over 70 people to get to their abortion appointments in collaboration with our partners at NAF Canada. And so we pay for train tickets, for plane tickets, for food, for taxi, for childcare, for pet care, for passport fees, anything that stands in the way, we are there to help and to help coordinate complex appointment logistics. We also have a sexual health information hub where people in Canada can access accurate, non-judgmental information about sexual and reproductive health, including abortion. This is to combat abortion disinformation and the kind of lack of information that people have around sexual health that is key to act on health decisions. Abortion is basic healthcare and it is normal. In Canada, 1 person in 3 who can get pregnant will have an abortion in their lifetimes. It is not always treated as such. While the need for abortion is common, access to safe and legal abortion services is far from guaranteed for all who may need it. As we witness the overturning of rights in the United States and global attacks on women's sexual and reproductive rights in Hungary, in Poland, in Russia, in the United States, we know that we must do everything we can to stand up for abortion rights in Canada and around the world, and break down the barriers to meaningful and dignified abortion care for everyone who needs it. Because what is the point of having a right to something that is impossible to access? What is being pro-choice without real, tangible choices? In Canada, making sure abortion is accessible to everyone is the conversation that matters, as both ministers pointed out. This is what we need to be talking about. While Canadians strongly support unrestricted access to abortion care across party lines in the public, many people still face serious barriers to care or fall through the cracks. Those who do are often the most marginalized, those who live in rural or remote communities, who are undocumented, are low income, or face racism or discrimination in the healthcare systems. We are very proud to partner with Health Canada for a project called Access for All, funded under the new Sexual and Reproductive Health Fund, to continue and expand on our work. This is work that matters. Thank you.
Merci beaucoup pour la période de questions. On me dit qu'on a fort malheureusement qu'une vingtaine de minutes. So I'll kindly ask everyone to keep the questions and the answers very short, please. We'll start in the room, after which we'll go on Zoom. So we'll start with Elie Quentin-Nantel, True North.
Good afternoon. My question is for Minister Ien. Minister Gould said that American women could come to Canada to get an abortion if Roe v. Wade is overturned, and Minister Menachino said that he alerted border agents that American women were welcomed. So my question, will unvaccinated American women who want to come to Canada to terminate their pregnancy be allowed in?
Thank you so much for the question. And as Minister Gould reiterated, Americans who come to, said before, and I will reiterate, Americans who come to Canada are able to access medical services here if they need it. They can access healthcare services in Canada. They will have to continue to pay for the service, though, out of pocket by their own private insurance, and that's important to note. If they are not covered by a provincial health insurance, or by the interim federal health program, or not insured health benefits.
So the data from the KFF shows there is a lower vaccination rates in certain marginalized groups in the United States who also have a higher reliance on abortion services. So again, would those unvaccinated women that may be in marginalized communities be able to come to Canada to get an abortion?
That is something that we will deal with. I don't deal in hypotheticals, but that is something that we will deal with in an empathetic way when and if the occasion arises.
On passe à Valérie Gamache, Radio-Canada.
Bonjour, M. Duclos. M. Trudeau, ce matin, a dit qu'il n'écartait rien et que ça pourrait même faire l'objet d'un projet de loi, la protection du droit à l'avortement. Est-ce que c'est à l'étude et qu'est-ce que vous en pensez de la possibilité d'enchasser ça dans une loi?
C'est une très bonne question. Et effectivement, rien n'est écarté, mais commençons peut-être par un énoncé d'où on est présentement et de ce qu'on entend par rapport à ce qu'on pourrait faire aussi par la suite. Premièrement, le cadre légal au Canada est très clair. La Cour suprême a été très claire. Le droit de choisir est un droit protégé par la Charte des droits et libertés. Deuxièmement, la loi canadienne sur la santé est aussi très claire. 5 principes qui s'appliquent non seulement aux soins de santé en matière reproductive et sexuelle, mais à tous les autres soins de santé. Et troisièmement, la réglementation est aussi très claire et ça facilite les travaux entre le gouvernement canadien et les provinces et les territoires. Maintenant, on entend des points de vue divergents, variés et importants en matière d'un renforcement possible de cette loi. Certains trouvent que ce serait une bonne idée parce qu'il n'y a pas au Canada de protection légale. Il y a une protection juridique, mais il n'est pas explicitement dit dans une loi fédérale que le droit à l'avortement est un droit protégé. Mais il y en a aussi d'autres qui disent que ce serait possiblement problématique de le faire puisque pour l'instant, il n'y a pas d'enjeu juridique. Le droit à l'avortement est protégé et que si on allait plus loin et qu'on essayait d'inscrire ça dans un contexte légal, il pourrait y avoir des craintes de la part des juristes par rapport à ce que ça pourrait représenter par la suite. Parce qu'un droit enchâssé dans une loi vient toujours avec des considérations qui pourraient, pour certains, limiter le contexte actuel, qui est un contexte où l'avortement est légal de par l'expérience juridique. Donc, aller plus loin, selon certains, pourrait ne pas être une bonne idée. Si on parle évidemment d'assurer et de garantir l'accès à l'avortement et aux services d'avortement au pays.
Et puis, je veux vous entendre sur la notion de timing. Est-ce qu'on est ici aujourd'hui parce que vraiment vous craignez une espèce de ressac d'une décision de la Cour suprême américaine pour avoir, ou est-ce qu'il n'y a pas quelque chose aussi avec le débat chez les conservateurs aujourd'hui, puis de ramener peut-être ça là, dans le clan conservateur?
Oui. Ben, deux choses là-dessus. La première, c'est que non, c'est un engagement du budget de 2021 dont on est heureux d'annoncer certains des résultats aujourd'hui, parce qu'on parle de deux projets, deux organisations importantes ici dans la région qui auront aussi des impacts partout au pays. Ce sont seulement deux projets parmi les 9 projets totaux qu'on a hâte d'annoncer aussi le plus rapidement possible. C'est aussi une première phase de cet investissement de 45 millions de dollars étalé sur 3 ans. Donc, cette année, c'est autour de 14 millions qu'on s'est engagé à investir. Ce matin, c'est à peu près 3,5 millions qu'on a la chance d'annoncer. Donc, il y aura d'autres annonces prochainement et d'autres annonces au cours des 2 prochaines années pour compléter l'investissement annoncé par le budget de 2021. La deuxième chose, c'est que on le sait, on a tous la responsabilité au Canada et ailleurs de défendre le droit des femmes. Et on le fait ici. Et on s'attend à ce que d'autres élus et d'autres leaders politiques, économiques et sociaux ailleurs au Canada le fassent, que ce soit ce soir ou ailleurs. La question est toujours la même. De quelle manière devons-nous travailler ensemble pour s'assurer que ce droit qui est maintenant protégé continue à être protégé et défendu? Mais pas seulement le droit, mais aussi l'accès, parce qu'il y a la liberté de choix, mais aussi la capacité de choix. C'est important d'avoir la liberté de choisir. C'est aussi important d'avoir cette capacité de pouvoir choisir. Et comme on a entendu de la part de Jill et de Frédérique, encore en 2022, cette capacité de choix n'est pas universelle à travers le pays. I think you wanted to hear in English as well. So two things. First, the fact that this is an important announcement, but not the end of the announcements. As you will have understood, these are 2 projects out of a total of 9 projects that we have been able to engage on with a large number of important, credible, and strong organizations across Canada over the last few months, following the commitment of Budget 2021 of $45 million over 3 years. This $3.5 million announcement today is only 2 projects out of 9 projects. The 7 other projects we are hopeful to be able to be more specific on very soon. $14 million in total for the first year out of the 3-year commitment of $45 million that will come. Now, the second thing is around in our responsibility as elected leaders, but also as community leaders. And I insist very much on community leaders who actually do the real work on the ground. They are collective and individual responsibility to keep defending not only the freedom to choose, but the ability to choose. And that is a collective responsibility. Every political leader and everyone in the House of Commons has the duty to defend that right, I believe, at least. And we all have the duty, as I said, not only to defend that right, but also to make sure that it is actually possible to access the reproductive and sexual health services that are human rights and absolutely essential health services in 2022.
Thank you. Next up, Abigail Beeman, Global.
Hi, Abigail Beeman, Global News. My question is for Minister Ien. The NDP last week put forward a call for universal access to contraception. That call has been echoed by others. I'm wondering if your government plans to move forward with that, and if so, what you believe should fall under the umbrella of free access to contraception.
Thank you so much for the question, and it's an important question given what we're talking about today and the fact that there are communities, and I listed them, Indigenous, racialized, LGBTQ2 communities who don't have the access, who are disproportionately impacted not just by the pandemic, but are in a position where they just don't have the access that others do. It's an important thing to note. It is something that we're looking at, and that's what I'll say for now.
And any comment on what you believe should fall under the umbrella of specific contraception that should be available for free? And if I could expand to also ask if either Frederique or Jill wants to weigh in as to the importance of this.
I was talking with Frederique and Jill just before this because I do believe that lived experience is so important, and talking about who they talk to and who they see and who they serve. And I would love them to comment on that because it really does answer your question. They're on the ground. They see who comes. They see who needs help. They see the rural women. They see the Indigenous women. They see the racialized women. They see LGBTQ2 members. So I am going to throw it over to them because I think lived experience matters and being on the ground matters and relaying those messages.
Thank you, Minister Ien. Yes, I think it is really important for folks to have access to the kind of contraception that works best for them. If you look at British Columbia, they've had a really great pilot project where they've been able to provide free contraception to people after they've accessed an abortion. And they've seen that that's had a really positive impact on people being able to make the decisions around their reproduction that they want and not having to be bound by financial considerations. So I think we see it's been very effective.
I'd like to build on that as well. This is a very important issue, and of course one that is linked with the one we are here to discuss here today. The people who are facing the most barriers to abortion care are often also the people who face the most barriers to contraceptive care. And so we see a significant percentage of people who are low income or working part-time jobs, who don't have access to insurance, who are not beneficiaries of provincial or federal programs that can help access to contraceptive care, really fall through the cracks. We also know that when we look at the kind of contraception that is used in Canada, it appears bound to financial ability instead of really what works for people, so in terms of rates of use. And so this is a program that would make a significant impact on people in Canada in terms of controlling their own fertility and bodily autonomy generally. And as Jill was mentioning, in terms of your question of what should be covered, I think it's important to make sure that it's not limited, because the choice of what works best for one person should not be attached to financial consideration. And so it should be the widest possible umbrella coverage for contraceptive care, because choice really matters in that realm as well. Thank you.
Thank you. We'll go to CTV. Glenn McGregor.
Thank you. A question for Minister Duclos. If you believe abortion services are essential health care, and it's not available to people across the country, and you're giving a very small amount of money to these third-party organizations to buy, in some cases, bus tickets to the United States to get those services. You have the power of the Canada Health Act to ensure the universality of those services. Why don't you use that and take on the provinces to ensure they're delivering these services in rural areas and across the country?
Well, two things on that. First, the power is there, and the understanding is there too. These are medically insured services. They are part of the medical services that are covered by the Canada Health Act. It's also really well understood by all provinces and territories that these medical services must be universal, accessible, they must be integral, and the other principles apply as well. Now, in practice, what happens is that there is the theory, and then there is a practice. And the practice we have heard from Jill and Frederique about. Now, if you find yourself in a rural area, in a marginalized community, if you're afraid of stigma, if you don't have the money to travel, if you don't have a connection to a healthcare provider, if you don't have the correct information, reliable and safe information on what it means in your particular condition, then you might not want or be able to exercise that right. So that's why today is about access. And when we talk about access, comes all sorts of services adapted to individual circumstances in a way that protects the dignity and the safety of the individuals.
Could you answer in English my colleague's question about legislation? Why not enshrine abortion rights in legislation that was passed in the House of Commons?
So again, two things here. First, there is the legal case for defending abortion is strong in Canada. It is based on the Constitution, on the Charter of Rights. It has been stated very clearly in 1988, and I believe there is no jurist across Canada who would believe that this case could be overturned. The second thing, however, is again about access. And if you were to legislate that right to abortion, if we were to go beyond the constitutional/legal strong foundation of that right in Canada, some jurists, some experts tell us that there could be a risk, because now there is currently no issue legal issue on the right to having abortion. But some jurists tell us that if we were to make that explicit in a law, then there would necessarily come conditions attached to exerting that right, and we have no conditions now around the right to exerting the right to abortion. So it's part of a important legal debate to which we'll be listening carefully over the next while. And as the Prime Minister said, there is nothing off the table.
We'll go to CBC with Olivia Stefanovic.
Thank you. My questions are for the ministers. Can you clarify what exactly are you looking to do legislatively to make sure that what's happening in the U.S. doesn't happen here in Canada? And how do you weigh the risk that anything you do legislatively could be overturned by another government?
Thank you so much, and it's an important question, and it really is about focusing on access, focusing on the rights we do have here, and that's why we're here today, focusing on what we have. And I want to add, too, that just to add to another question, I'm not sure who asked it about the timing of today's announcements that we have, and the minister correctly said that there are many more announcements to come. But I will just say, as the Minister for Women and Gender Equality, it is never a bad day to talk about women's rights in our country and the right to choose in this country. It is never a bad day to do that.
At your personal views, ministers, what is your view on whether Canada should have a law codifying abortion in this country?
Our view is that everything is on the table. The Prime Minister repeated that recently. We are mindful that there are, among those that want to protect the right to an abortion in Canada, among all of them, there are different views. So they all agree on the importance of doing that. They differ as to how it is best to do so. So we'll continue to listen to their advice, and as the Prime Minister said, there is nothing off the table.
And I just want to reiterate that, and it's important. I come from a background of research, and it's important to do the research and do the deep dives and understand what's on the table and make decisions listening to stakeholders, to those on the ground, like Frederique and like Jill and others who are doing the work, involved in the work. And I will say again, the Prime Minister has said that everything's on the table, because we are listening. We're listening to those that are saying, listen, there are gaps here, we need more work here. This is ongoing, obviously. This work doesn't end. It's something that as a government, we are working together on. Our mandate letters, many of them coordinate and have a lot to do with working together on this issue and others. This is an all-of-government approach, but listening is at the core of it. Listening and then action, yes, but listening and researching and doing the due diligence first.
Erica Abraham, Canadian Press.
Hi there. Thank you so much for taking questions. I was wondering, Minister Duclos, I know you provided an answer to this question in French, and Minister Ien did respond. She provided her own response on the question of why now, but I was wondering if you could provide that in English as well.
The question on the
timing of
legal what?
Sorry, the timing of the announcement today.
Oh, okay, sorry. Okay. I was distracted. I thought the question was going to the minister. Well, no, there is absolutely no connection. We've been working with Action Canada and the Federation for many months now, and we look forward to making more announcements. There are 7 of them coming very soon, and as Marci said, every day is a good day, especially in the international context in which we're living, a good day to speak and to act on that matter.
And I believe you mentioned $14 million is set to be spent in the first year from this $45 million fund. It's my understanding that $16 million was meant to be spent before the start of 2022, according to last year's budget. And I'm curious, how will you ensure that all of these funds will get spent within the remaining years, because there is sort of a 3-year limit to these funds?
Maybe I will answer first and then turn to Jill and Frederique for what might follow. I have absolutely no doubt that these funds will be important for communities and that these funds will be fully used, because what we understand is that the demand and the need for those services is very significant. We are in a country with still very significant inequalities, including inequalities in access to health care. And these organizations that we have with us today are both very knowledgeable and very credible when it comes to speaking on those inequalities that limit both rights and access to health care services.
Yeah, so obviously we've worked well on our budgets and know what some of the needs that we have, our expenses, so we're well positioned to spend all of our funds in the time that's been allocated. But I actually just wanted to add one thing, if I could, that people are talking about timing and access. I mean, I think it's really important. There's so much stigma around abortion care, and having a federal government that's actually talking about abortion care when we hear about news from the United States and always is really important. We want to make sure Canadians get the information that's from Canada and not hearing about what's happening in states and worrying about access to abortion being even more limited in Canada than it is. So I think it's always, as you said, Mr. Ien, it's always a good time to talk about it, and especially when it's in the news for other reasons, to make sure that folks are familiar with what is available here in Canada.
We'll go with Maura Forrest, Politico.
Thank you. As a question for the ministers also, just on this question of legislation, you've all been saying, the right to abortion is strong in Canada, the debate is closed, that no court would countenance a restriction on abortion rights, and yet you're also floating, the Prime Minister is also floating this idea of legislation, but you're not committing to it. Don't you think that's a confusing message to send?
I think it's it's a message which is part of the broader picture. I believe many Canadians, and certainly many Canadian women, are a bit worried about what is happening on our continent. Many of them know that where we are today has been the outcome of a hard and long battle over many decades, fought by the feminist movement many years ago. But that, although there has been a victory, the battle continues, and therefore I believe, and Minister Ien might want to add her perspective on that. I believe that the achievements and victories for women can never be taken for granted and never be interpreted as final victories. We always need to do more, because there will always need to be more to be done.
And I absolutely agree. And here's what I will tell you. When we saw what was happening in the States, I, for one, wasn't well during that time, but I certainly was reading. and I certainly was watching, and I felt sick. Many of the women that I talked to, some had to just pause, just to reflect on the information, because it was hard to look at that. And Canadian women know, and they know well, that it's important to protect this. And so the Prime Minister, rightly so, is keeping options open because things change. And we know they do. Things are fluid. And when you keep all options on the table, then there is, the ability to move and move quickly if necessary or not. But it's important to have all options. And that's why the Prime Minister, that is why our government is doing just that. I don't find it confusing at all. I think more options are a good thing as we keep a close eye on what is happening here.
You mentioned there, women being very concerned about what's happening in the U.S., but you've also both said that the timing of this announcement is not related to anything in particular. Is this not meant as a way to reassure people who are watching the Supreme Court leak around Roe v. Wade that the same thing won't happen here? Is this not meant as a response to that?
Our government has been consistent since 2015 on this issue. This is not new for our government. It is certainly not new and should not be new for anybody that has watched or heard what we've said through the years. We have been consistent on this issue, and we're amplifying that message now. This is about consistency, and we have been consistent. This is not new for us.
I also thought briefly that a comment made by Jill just a moment ago was very important when she said that there would be, unfortunately, women in Canada now, and some of them quite vulnerable, who would think that because of what's happening in the United States, it will be more difficult. It might be just be filled with stigma to want to have access to reproductive and sexual services. And that, if that is true, and I certainly believe in Jill's judgment, that would be of great concern.
Merci. On a dépassé la période allouée aux questions, but we have just a few questions on Zoom. I don't know if you ministers are willing to extend a little bit this time period, or are we calling it in? It's over. That's all right. So that puts an end to this press conference. Thank you very much all for being there. Welcome.